start with, why talk about neurodiversity and mental health? And I'm just going to spend a few minutes to set the context a little bit. And we're starting with our friend George. So we meet George when he's 17. He's one of 3 children in his house, in his family. He lives at home. And at the age of 8 years, his parents were told by the paediatrician and the educational team at school that he needed some extra help to try and access the curriculum. He wasn't doing as well as the others in his class, and that was because he had a moderate learning disability. But with all of that, George really enjoyed primary school. He had the best time. He had lots of friends. He was well looked after, and then wrote common entrance and went to his local secondary school along with quite a lot of his friends from primary school. So he really continued to enjoy being in education. His secondary school gave him skills in woodworking, and he enjoyed sports. He left after CXC and started working in the local shop, and he enjoyed that. He had a routine. Every day he'd go to the shop, help with packaging groceries, in stacking shelves, and was a really friendly person, and also enjoyed, of course, checking his bank account with his mum when he got paid, and that gave him great joy. But then a few months later, his parents found that he just was sleeping quite a lot. It was harder to get him to go to work. He didn't want to leave home anymore and was really irritable. And they just couldn't understand why. They tried everything. The aunties came to talk to him. His older siblings were like, "Come, George," trying to encourage him along. And after several weeks, George was seen by the doctor, and the doctor told his parents, "I really think that George is depressed." And his parents were really confused. They were like, "But George has a learning disability. How could he have depression? How do people with learning disability have depression?" And so that's one of the reasons why we're having this talk today. It's understanding more of that interface between mental health conditions and neurodiverse conditions, because we do know from the research that one, if you are diagnosed with a neurodiverse condition such as autism spectrum condition or ADHD or dyslexia, you're more likely to have another neurodevelopmental condition. But also we know that you are at a higher risk of a mental health disorder or condition. And on this slide, you'll see just one of the ways that we would communicate that you can be depressed and it can be treated. You can have some help with it in language that George would understand. Describing the features of low mood in a way that makes sense, a way that someone with a learning disability is able to grasp, being truthful about the facts that we don't quite understand the causes, etc. And then just in simple language, talking about ways that we could help. And with thinking about George, we're also going to, touch on Reshma, who who's put this forward today that, she's come into clinic to see me or one of my colleagues, and she's telling me that the doctor told her mum that she had autism when she was 9. She enjoyed, she passed common entrance, she had extra time. It was good, and she got to wear her headphones when she was doing common entrance. Form 1, 2, and 3, no problems. Now that she's in Form 4, she's in the doctor's clinic because teachers are always telling her to stop moving around. She cries and she doesn't know why. And so on the face of it, based on this snapshot of information that we have, we can tell that with her diagnosis of autism, Reshma has sensory sensitivities, and wearing the headphones allowed her to block out the extraneous noise that was causing her anxiety, and that allowed her to concentrate and complete her exam in the extra time. we're also thinking about our school system and the transition that happens as children move from Form 1, 2, 3, and then Form 4 when they're starting to get ready for those exams, and the change in the teaching style, the change in the subjects, the expectations. And so for Reshma, what was happening with her is she was becoming incredibly anxious in school. And just on this slide, which will all be sent around later, it's thinking about how do we assess anxiety in someone with a neurodiverse condition, and that is, you know, as we would with anyone. Thinking about their symptoms, what could be the bits that are contributing to them, and with that understanding of their current developmental level as well as where they are in their age. And then thinking about the different types of treatment, which follow broadly along the same lines as you would for those who are neurotypical. But I draw your attention to the concept of modified CBT, where the nuances are such that it works better for folks with a diagnosis of autism spectrum disorder. And then there are a couple of links in there to some plain language explanations what anxiety is and how we could help with autism in particular. So that's just a whistle stop to think about mental health conditions and their presentation in neurodiverse conditions. We talked about two in particular, but my colleagues are going to speak on more general terms and highlighting a few specifics that we might find of interest. And so at this point, I'd like to hand over to Dr. Katija Khan, who will introduce herself and take you through the next bit. Katija?
Thank you, Dr. Legere. Good afternoon to everyone. Good afternoon, Mr. Francis, Ms. Murray, and to everybody who's joined in. I think it's fantastic to you're giving up your lunchtime and wherever you are in the world, whatever the time is, for us to talk a little bit about neurodiversity and mental health. So I'm Dr. Katija Khan. So I'm a lecturer in psychology at the University of the West Indies in St. Augustine, Trinidad. I'm also a clinician, a clinical psychologist, a neuropsychologist. And I'm also involved in the professional practice of psychology in the Caribbean as a former Trinidad and Tobago Association of Psychologists president and a current president of the Caribbean Alliance of National Psychological Associations. I do want to thank the Neurodiversity Foundation for the invitation to just share a little bit, and I'm looking forward to some of the discussions and interactions. So when I was approached, I said, okay, well, what do I want to share with people? And I know when we only have an hour, we don't have time to find out who's in the room, what your background is, what's your context, why you're attending, what you came for. So we're going to hope that what we share, some of it sticks and hits with you. Can I just try a little exercise first? Can I ask all of you to just picture in your mind a banana? Okay, so I've chosen a fruit that I think everybody is familiar with. So picture a banana in your mind. Can you picture it? What color is it? Picture a ripe banana. So how ripe is it? Can you picture the yellow? Can you picture any brown spots? Is it a gummy shell? Is it a sikke fig? Is it, what shape, what size, what length? Are there, is there any of the stem there? So why am I asking you to do this? Do you know that people vary in their ability to do that? To call to mind a picture of a banana? I can do that, pretty easily. I can picture a banana in my mind, but guess what? Not everybody can do that. Approximately 1 to 3% of people in the world, they estimate, cannot visualize objects as easily as others. They actually have a term for that condition. It's called aphantasia. And then there are people on the other end of the continuum who are really, really good at that. And they can give you immense amount of details. And they are hyper-phantasic. So why did I start with that point? When it comes to neurodiversity, and when we think about the brain and how the brain functions and our ability to do things, how we see, how we hear, how we think, how we feel, we normally assume that there's one way to do that. There's a typical way for us to do that as human beings. But what the science and the knowledge has taught us is that actually, no. That's the essential foundation of neurodiversity, that we experience the world in different ways. People vary in how they perceive things. And guess what? That's very normal. It's very, very normal. So just as how if we were to test, if we were to do an IQ test on everybody in this webinar, we'd vary where we were. There is neurodiversity in our experiences. And the more we learn, the more we refine our knowledge, the more we do research, the more we find out about it. And I start with that because it's really important. Because when we don't appreciate diversity in all its forms, when we don't appreciate or when we attach value judgments to things, meaning this way is good and any other thing is bad and we need to change it, that leads to problems in people's lives, in children's lives and adults' lives. So that's the first point, that we experience the world in different ways, and that is what neurodiversity is about. The other thing I wanted to talk about is mental health. Yeah. So there was a time when we would kind of conceptualize mental health and mental illness as a dichotomy. So there are those of us who are sane and there are those who are insane. And as the people we see in St. Anne's and psychiatric hospitals around the world. So we would have these two categories of people. But we also know that mental health and mental illness doesn't exist in these dichotomies and these categories. It exists on a continuum. So think about your mental health. And if I were to ask you, well, you know, on a scale of 1 to 5, what's your mental health like today? Well, where you lie on that scale depends on a number of factors. Your genetics, your family history, your vulnerabilities and susceptibilities, but also what's going on in your life. Are you having good opportunities, successes, fulfilling relationships, meaningful opportunities, satisfying experiences? The more of those you have, the better your mental health. But if you take a knock, you lose your job, your children are ill, you have some financial problems. In the pandemic, many people were dealing with many of these. That could take a toll on your mental health. So your mental health can vary along the continuum based on a number of factors. So we're also seeing there that there's no one way to be when it comes to mental health. And apply that to the same thing to mental illness. So there's a threshold on that continuum by which professionals use to diagnose when somebody fits criteria for a psychiatric disorder or a mental illness or a label, one of the labels. As a psychologist, I'm not too much caught up with labels. I'm usually more concerned with what does that mean for a person's functioning in their real life and real world. But what we are concerned about is the amount of impairment or distress that a person might be experiencing. And that latter part is often a function, and there's a third point I wanted to make, third and final one, and that's about stigma and discrimination. As humans, and again, a lot of times we're wired a certain way. We like certain things a certain way. So symmetry is one of the things we like. We like things. And so people who have more symmetrical faces, we tend to think that they're more attractive, like Denzel Washington. He is supposed to have quite a symmetrical face. And, you know, many people think he's attractive, myself included. In the animal kingdom as well, there's also a preferred proportion, a waist to hip ratio that exists both in the human species and other animal species that's preferred. But notwithstanding certain preferences, there's room for diversity. There's room on both ends for people to experience the world in different ways, to exhibit different kinds of behaviors. And oftentimes it's the stigma that we have and the resultant discrimination that makes things very difficult for them. And it's them trying to cope with what this world is putting out against them that often contributes to them having difficulties functioning in their everyday lives. So the difficulties, not because of their brain and how they're wired, but because of the experiences that they're having in society. So that is one of the biggest barriers to people leading fulfilling lives, having good mental health. And so in wrapping up, I hope that conversations like these, not I hope, I know that conversations and discussions and interactions like these can lead to more awareness, and that it will help influence at all levels. So whether you're a parent or a teacher or a professional, that knowledge can impact us in different ways and help to improve the kinds of practices and research and teaching and interventions we do. Yeah, and that experience exists. And I just had a tiny little quote from one of the studies I was reading. You know, when we look into things like these, the amount of diversity that exists, and specifically as it pertains to cognitive things, that it's important for us to do things like these because they validate the difference and experience that people often find hard to convey. We can't rely on people who are going through something to be their own advocates. So the rest of us who have the power, the means, the knowledge, the ability, the resources, we have to step in and do the work to help make it better for everyone involved. So thank you. I hand back over.
Thank you, Dr. Khan. That was very interesting and insightful. Advocacy, knowledge, support, validating difference and experience. I think they're all ideas that we hold dear, things that, you know, together on this call, we try and emulate and promote. And at this point, I'll hand over to Caroline Murray, who will continue to speak on the theme that we're developing in terms of identification support and ways that we can work on validating and making things better. Caroline?
Hi, thanks so much for, I guess, inviting me to talk today. My name is Caroline Murray, and I am an Associate Director of Learning Disability and Autism, and I work in London for an integrated care board. But beyond that, I trained as a mental health nurse, and I've spent several years working as a clinician, but also as a public mental health specialist. And now I sort of commission services and look at how we can, I guess, ensure that people are discharged from hospital appropriately, who don't need to be in hospital here. So my task was to, I guess, stimulate some conversation and discussion about systems that support the best outcomes. And I guess this is, I guess, broadly speaking, and applicable no matter where you are, because we have to take a broad approach and brush to this in terms of support systems and what we actually see to be systems. So broadly speaking, I think we can sum up the support that will give us the best outcomes in terms of our family and friends and the network that we can have there, the community resources, and education and training. I think that as we've become more aware of neurodiversity, and particularly as the prevalence of autism and ADHD has increased, and I think that is across the world, we cannot underestimate, I think, the level of family support needed from parents, siblings, grandparents, friends, because we know that being neurodiverse is not an illness, and we need to create, I guess, a culture where there is acceptance of difference, strengths, and abilities. And I think the key bit about having a friends and family network is the ability to accept, as well as to be able to advocate and have that advocacy to be able to help people to realize their strengths. I know hopefully Adanna Williams might be here to talk a bit more about the strengths, but I suppose it was building on people's strengths is the thing that we need to think about. And I think that families and friends, you know, need to be resourceful when seeking help to support where it's needed, because you really need to explore and I think the help that you need. Finding online resources, using social media. There are some good social media links that you can and you know, follow pages that openly talk about the realities of being autistic, for example, or how we can work to set up groups. Some of the work that I've been involved in has been around setting up of informal social groups for opportunities to make friends, because I think that is something that is particularly important for anyone, especially if you need a little bit of help to do some things. And I think we definitely need to see family and friends as a vital protective factor in all that, when we're thinking about neurodiversity and mental health. So I think that families and friends are really ideally placed to advocate for their loved ones and getting the necessary reasonable adjustments that are made, because I think the outcome that we're seeking there is long-term intended, I guess, the independence that it can then have for people to live well in the real world. And I know, as Stacy mentioned around, that young person who had the headphones. It's about making those reasonable adjustments and advocating for those where people are, so that they can live well, because that is, as I say, ultimately the ultimate intended outcome. In terms of community resources, I think about it in terms of accessible services that are inclusive. And I think that inclusivity is something to really look out for, when you're looking at community support. Because help and support from the community, whether you get it from church, from your neighborhood, clubs, school, or societies, access is really important. And I think feeling welcome in the community that you belong to, belonging, sharing your talents, feeling understood, and being in I guess, a sensory friendly environment. If, for instance, you're neurodiverse, I think these are the things that we need to consider. Consider the lighting for people, loud noises. How do we adapt spaces where people meet, for instance, to allow for the diversity and the needs of all of us. I think there's the need to consider how we include people so that, I guess, there's equity of access, and where possible, create a type of environment where that is needed for the people that uh, um, I guess, have diverse needs. And there's something about being brave and saying that when you identify that there might be, I guess, gaps, being brave to stand up and say, we can adapt and we can make amendments for that. I think the sort of outcomes that you will get from having, I guess, good community resources, are the things, I think, importantly, around reducing loneliness and isolation. I think that is something that is really important. And, as I mentioned before, social groups, creating those opportunities to make friends and to share interests. And I guess finally, I guess the fact around um, education and training, knowledge and information is something that I think it's ongoing. And I think it's quite self-explanatory, but we cannot forget that as we do more research and there are ongoing improvements and developments in our knowledge base around things, and that we really need to have information uh, to I guess you'd really need to have the information to make some of the changes or adapt as we go along. Um, I think good quality education and training is needed really to build capacity in our families, in our communities. So I think we definitely need to consider education and training and finding those resources. Um, I think as well, when we consider that there's a lot of change happening, and as we can see that from the examples that Stacy gave, that the transitions over the life course, because we have people starting school, whether it's primary, secondary, leaving school, starting work, marriage, bereavements. There's a lot of change that happens, and I think we need to equip ourselves with information and good knowledge to ensure that we can, I guess, navigate our way through life. And I'll stop there because I think we want to continue on with some and hear some of the views. Over to you.
Thank you, Caroline. That was a really helpful framework for us to start thinking about supporting mental well-being. Not just the figures that we quote in terms of, being more at risk of a mental health condition or illness when you have a neurodiverse condition, but also, what are the positive factors that would help? And moving swiftly on, we're joined by Adanna Williams, who will explain a little bit about how we can apply a strength-based thinking in terms of support. Adanna, we've all been introducing ourselves and continuing with our talk.
Hi, good afternoon. Can you hear me okay?
Yes.
Okay, good afternoon, everybody. My name is Adanna Williams. I work in the NHS in the UK here. I am, I've got many hats, but one of them is Deputy Director of Nursing for Professional and Systems Development for one of our 7 regions in the UK. But I am also the regional head for autism, learning disabilities, mental health, and special education needs. So this is an area of passion and an area of, I suppose, expertise, but I always say to people I'm a nurse first, so that always comes before everything else. And a wonderful afternoon to you all, and it's a real pleasure to be here. So I do have some slides to run through. There's a number of them. I'm not very good at sticking to my slides. I will warn you all in advance, but I will try to be disciplined this afternoon, so bear with me. I'm having some issues with my technology. So do I need to share from this side, or will someone share them?
Yeah, I can get Jeremy to pull them up if you're having
please, that would be helpful.
Yeah, okay, we'll do that. So you can keep talking until we get them up for you.
Yes. So, well, I literally joined when you said hello, so you all will have to forgive me. I'm running from one meeting to the next, so slightly disorientated this afternoon. It's been a very long day for us over here. But so I haven't had a chance to see who's joined us, so I just want to say hello to everybody. And as you can hear, depending on who you ask, I'm also a Trini and love my home country. So I welcome every opportunity to share that. And I can tell you now, one of the things that we are doing here in the UK in relation to autism and learning disabilities care, we're focused now on planning whilst I'm trying to get my slides up, because we have been looking at how we could refine and improve the service offer for our families here in the UK. So a lot of this work that we are doing on the call is things that are part of our core business here in the UK. We've been evaluating our services, recognizing where there's opportunities for improvement. And, oftentimes people think that we get it right in the so-called Western world, but we've still got a long way to go. And one of the areas that we are looking at is how we can refine and improve care delivery, and do that by taking this strength-based approach that I'm going to talk you through. So if we can move to the next slide, please. So essentially, the intention today is to talk you through some of the principles of using that strengths-based approach, and hopefully at the end, we will have a shared understanding, an overview of that principle, and hopefully an understanding of how you could potentially apply it into your everyday interaction with those with a diagnosis of autism. And it can also be used for those with learning disabilities. And I think you'll find as well that strengths-based model could be applied to multiple different aspects of life. But for the sake of this presentation, we're going to focus in on some of the benefits of using this approach to support our autistic citizens. So if we can move to the next slide, please. So I'm sure this has been covered already. You will have an understanding of what autism is and how that fits in to our world. And I like to tell people, I said, I like to consider my autistic individuals like snowflakes. They're all unique, very beautiful when you look closer. And for us, snow can be pretty when you see it from afar, but can sometimes with some challenges when you're trying to navigate it. And it's the same for individuals with autism, but that's more because of us and our lack of understanding, but rather than the individual in themselves, you know. And another important thing is they can teach us so much about ourselves that, you know, we can learn so much from autistic individuals. So could we move forward onto the next slide? So talking about strengths-based versus traditional. So traditionally, when we talked about those with autism and or learning disabilities, or even when we're speaking about any health-related challenge in general, it's usually spoken about in the context of deficiencies. So, you know, they can't do this, they can't do that, and speaking in the context of lack. What the strengths-based approach encourages us to do is to help to get a deeper understanding of the individual through assessments, and they're usually continual assessments, but understanding what are the unique characteristics of this individual that we can build on. Because as we know, many people in our society who present with autistics, present on the spectrum, have specialists and special gifts and various aspects. You know, sometimes it's attention to detail, sometimes it's extreme proficiency with mathematics. It might be a passion about a specific subject. There may be many different, they may be excellent analysts. I have somebody that I work with who is autistic. The reports that this individual produces is top-notch. So they're able to assimilate and articulate data in a way that we wouldn't have even considered, you know. And it's really important to understand the strengths of these characteristics. So what this approach does is it encourages deeper analysis and assessment, person-centered and focused understanding of that individual. And then when you've got this, you then identify and capitalize on how you can extrapolate that strength, build on it, and help use it to improve that person's experience of the world around them. And it can also help you to inform where perhaps there might be gaps in that individual's functioning that you may need to make some adjustment to their individual environment, and how you can support them to navigate everyday life and activities of daily living as well. Can we move to the next slide, please? So again, the principles are based over these 5 core, and depending on whose research you look at, they may extend them further or might describe them in a different way. But the key principles to remember, as I said, it is asset orientated. So focus on identifying and leveraging and harnessing that strength. So as I say, looking at what we can build on for this person. So for example, you may have somebody on the spectrum who's presenting perhaps with the deficiencies in their ability to express themselves verbally. That individual might be fantastic at writing. So it might be about understanding how you could enhance their communication by building on their way of relating to you to help to strengthen their experience of the world and education. Individualize that. So as I said, we look at a closer assessment, comprehensive assessment, and building a model of support and care that is bespoke to that person. So every individual's presentation of autism might be different. So you want to ensure that any care you are designing is suited to that individual. So bringing it back to that snowflake analogy, no one snowflake is alike. And it's the same for those who are on the spectrum. Collaboration is one of my favorite words because it means bringing together multiple individuals, specialisms, services, even multiple community support mechanisms to help enhance that individual's experience of care. So that could mean for us in the Caribbean, our family. It could be your church members, it could be the teachers in the school, you know, it could be your pediatrician, whoever is involved in that person's life, you bring them into that process, keeping the individual at the core, at the center, and ensuring that any decisions you make about care and support, they are on board and you're doing something that will embrace, enhance, and support them as they move forward. And as I mentioned before, strength amplification. So it's looking for where you can have those opportunities to empower and support and enable that individual, and looking for places where you can develop and enhance new skills, or perhaps drive them in a direction, you know, to help enable them to function at a higher level within society where functionality might be an issue. And last but not least, it's about the language. Language is powerful. How we label and communicate with others is really important to their progress and development. So we want to use the language of positivity. We want to use the language of winners. We want to ensure that when we are framing our descriptors and when we are interacting with our autistic loved ones, that we are doing it in a way that, again, speaks to their strengths, enhance them, is supportive, is understanding, is at a pace, and in a manner that helps to enable them to engage in a meaningful way with that specific interaction. And sometimes, again, as a part of that assessment, we might need to look at how we modify our mechanisms of communication to enable the most optimum opportunity to have that interaction. So it may be you're working with somebody who might be nonverbal. So therefore you might use pictures, you may use drawing, you might use art. So whatever mechanism that individual enjoys, it will help you. And I can tell you a story about a young man that I met along my career, who for a long time people felt he was nonverbal, unable to communicate, until he had an assessment where they were able to identify that he understood Makaton. So that was the mechanism that they were using to communicate. And this individual was presenting with behaviors that challenge. So when we understood how to reach him and how to communicate with him, he was then able to articulate his need. We were then able to understand what was triggering those behaviors and was able to offer a solution that then helped those behaviors to be reduced to the point where they stopped entirely, and he was able to become more independent because we opened a different channel of communication. Next slide, please. Okay, so I talked a little bit about this already, talking about identifying those strengths. And as I say, it could encompass a wide range of abilities. It could be from art, it could be from piano playing, it might be about, somebody that's able to do creative things. It's all about how they can express. It could be something about pattern recognition, number recognition. There's so many different wonderful things those who are on the autistic spectrum can do for us in society and can add to society. So it is our job to work with those individuals and understand where is their specialist skills, where we can tap in. And it might not be something that's easily recognizable, or might not be something that, might be that wow moment for others, but it will be for them. So our role and our job is about seeking out that in that individual, identifying it, understanding it, and building plans and support systems around them to enhance that, and looking at how we can capitalize on that trait, that characteristic, and that strength to include and build and widen that individual's experience of the world and life. And again, I mentioned it before, assessment is key. Early assessment is key. So for those of us who are parents, those of us who are in contact with children, it's really important when you identify that there might be something different about a young person, where you can see that perhaps they may need support in particular areas. It's really important for you to get that shared and deeper understanding, hopefully using a professional route. And I'm mindful in Trinidad, some of the access to some of the services may not be as wide as we would like it to be, but we're building on it. And this forum is even an example of how we're doing that. But it's really important to get those assessments, get those observations. And I say to people all the time when I speak and meet with them, we have the internet. It is not just for Facebook, Instagram, and TikTok. There is a wide range of really reliable sources where you can get access to some of those tools that can help you to understand better those you come into contact with and help you assimilate and understand the information that's being shared. So, if you want some signposting on that, I am sure those of us who are on this panel will be able to support you and guide you in getting the right place for that information. So let's move on. So I gave you some examples already, but we can group them into different areas where you can draw from this strengths-based interventions. Because as I said to you, we can use them in multiple different areas of life, of care, of education, of interaction. Even when it comes to personal relationships, you can use a strengths-based approach to help inform and support the way that you communicate and interact with those in your sphere. So I mentioned about special interest utilization. So that's when I said to you about things like the artwork and different things. So you can build in learning and therapeutic activities around that. I'm sure we've all heard about art therapy. That's the way that you can do it. There's music therapy. I even had a patient once who did horse therapy. So, you know, you can use many different mechanisms. And the great thing about us as human beings is we have the ability to be innovative with the things that we do. So this is the challenge that you have. So you also have to be unique to help support those who are unique. The other bit that you need to do, and I mentioned it before, it's about strengths-based communication. So it's about using that individual's preferred communication style. I told you about that young man who everybody thought couldn't speak, who everybody thought couldn't communicate, until we identified that Makaton was the way to go. And that young person is thriving. And I must tell you now, went from living in a residential supported accommodation to now being in the community. So it was a residential school. Now being in the community and interacting, going to church, doing multiple different things. I caveat that by saying that experience might not be the same to everybody, but it's a clear example of how understanding this individual's needs and journeys help us to modify a care plan to optimize their experience of the world. That may not be the experience for everybody, but it is important for you to ensure that you've got really robust assessments that underpin any care planning and support you do. Strengths-focused education. Let's move on. No, we can move, because I think I touched on the other areas already, and I'm mindful of time. I don't want to hog all the time we've got together. So I talked already about some of the benefits, but there are 5 here that I brought because these I feel are the key ones, and I want you to take this away with you about what it can do for an individual. So I spoke a lot about empowering and enabling, and it's about building that confidence and that self-esteem and helping that individual to understand their self-worth, recognize the contributions they could make to society. I mentioned about increased motivation and engagement. I bring you back to my young man, and I know his mom wouldn't mind me sharing his story with you. He was somebody that was really demotivated, and as I say, was experiencing serious behaviors that challenged. And I'm talking about lashing out, damaging property, not wanting to engage in any activities of daily living, which include personal hygiene. We went from that to a young man who was cooking, going to church, spending time with his family, was able to have pets, and is now living in a supported independent accommodation. As a teenager, I knew him since he was in his early teens. He's now heading to late teens and is thriving. We talked about social connections. So he was isolated, living on his own and unable to have any social contacts because there was always concerns about the risk that he presented to himself and others. I mentioned he's going to church, he is going to school, he is doing multiple things that others said he could not. And again, it is a lesson to us that we don't know what we don't know, so it is our duty to find out. Sustainable progress. So for him, it was a gradual improvement over a number of years. I met that family 4 years ago. We are 4 years on, and he's continuing to improve and thrive. Every month they're discovering and learning something new, so it's important for us to realize it is not a finite process. When it comes to care and treatment, it is a process of continual assessment and review and analysis and looking at evaluation and perhaps change that comes alongside that. And last but not least, empowerment and autonomy. It's really important that we encourage our autistic individuals in society to recognize the values that they can bring to us and how much they can teach us and help us to learn. So let's move on. Okay, so I mentioned about a case study. I won't go over Sarah's, but you can review this later on, and it's talking a little bit about how art was used to help focus Sarah and help to empower her and help to improve her ability to engage with education, which we know is a key part of ensuring that our citizens are able to, give a good contribution and increase their opportunities in the world. So I'll move us on to the next slide, please. So, as I say, in conclusion, the strengths-based approach might not be the panacea for everything. It really isn't, because sometimes, as we know, we get the best outcomes when we have a multi approach to care. So it might be about strengths-based, it might be about positive behavioral support, it might be about, there's a multitude of different things that we might want to do to enhance a person's care and to enhance a person's opportunities in life. So this is one that's close to me because I love the empowerment message in it. I love the fact that it brings along all those agencies that are involved in that individual's life. And I really love the fact that it keeps them at the core of what you do. And I especially like the fact that it encourages us to change our language, change the way that we view autism as not a deficit, as not something negative, but rather a unique individual who has something to offer, and it is our responsibility to uncover what that is. So I will pause there for any questions or any feedback. So thank you so much for listening.
Thank you very much, Adanna. And at this point, I'll get the rest of the panel to join us for any questions from our participants. As you know, Adanna, that's one of our messages at the foundation. It's not a deficiency, it's a difference.
Yes.
And we embrace differences. And you can pop any questions in the chat or stick your hand up. We've got a few minutes to have feedback from all of you who are kindly listening.
And can I say, Stacy, what you all are doing with the Foundation for Trinidad is unbelievable. You know, it's so amazing to have a platform here where we can uplift and educate our citizens and share some of the knowledge that we're bringing from the Western world. I say to people all the time, Westerners have taken so much from us in the islands, in Africa and everywhere. So it's really important for us to come back and pay that forward and put back into our country. So thank you so much for inviting me to the platform and creating this space.
Thank you, Adanna. I think one of the other strengths that we've got in the foundation is a lot of our work is informed by neurodiverse individuals, and we work with them hand in hand, you know, in our functions and as well as in the work that we do.
Brilliant.
Great.
I think I've stunned them all into silence.
Stacy, if I could just make a final comment, because I know we'll soon be finished. Just to bring it back to a bit of the context in Trinidad and Tobago. And at this point, I also want to acknowledge the efforts of groups in Trinidad that are working assiduously. Autism Society, ADHD Foundation, Stacy, I know Neurodiversity Foundation has been working with the Autistic Society as well, Diane. But I think a true appreciation of something like a strengths-based approach needs to have an accompanying infrastructure and philosophy if it's to work. Otherwise, it's just something we read and something we hear about. So I think that it has to go hand in hand. For example, a lot of the efforts when we're in limited resource settings, a lot of the efforts towards treatment in the public sector is still towards medication, ensuring we have the medication on the formulary, and there is little to no priority about ensuring that there are non-pharmacological interventions that are also available. That medical model dominance also skews it towards physicians and not practitioners like nurses and social workers, etc., who have an incredible role that they could play. So I think building out that or advocating for that accompanying infrastructure, as well as ensuring that assessment is accessible and available. Right now, waiting lists in the public sector can be a year and more. By that time, the child might have gone through a few more developmental phases, and you know, it's a different picture. And finally, accommodations in schools, accommodations in workplaces. There is a lot of ground we have to gain on that, because the mentality is sometimes I'm giving somebody an advantage, or why should they get special treatment? This is not about special treatment. This is enabling people to function, and it's their right for children. It's part of their universal human rights. So changing that mentality.
Thank you, Katija. That's absolutely spot on. And with that, one of the comments in the chat is whether do we think it's helpful that neurodiversity should still be in the DSM-5 criteria, since it's not necessarily a mental disorder? And I think one of the things that we're trying to say is it is not a mental disorder. The DSM-5 is a list, along with the ICD-11, of all health and medical conditions that cover the span. The lens that we've taken today is deliberate in not focusing on pharmacology and the medical model, but bringing to the fore that the support required in most cases where we have failed to make adjustments or haven't done our initial assessments in a timely manner are around systems and support mechanisms as opposed to medical treatment.
Can I just add to that Stacy? I think one of the things that Katija and you've mentioned in terms of that diagnostic, and it's not an illness, as I said, is the fact that we need to start thinking about meeting people's needs, because as you say, when people are waiting for a label, as it were, or a diagnosis, we're ignoring and we're, I guess, effectively letting things get worse. So I think we need to start from a point of identifying that there are needs and have that needs based, have those needs met wherever people are at, whether it's just before they start school or as they're transitioning from primary to secondary. I think we can get hung up on that diagnostic because waiting lists are high every single where that I'm aware of.
Yes. Thank you, Caroline.
I agree. Can I respond to Khadija's point as well? Because I think you made a really, really important point about the policies, and that's kind of my bread and butter. And trust and believe, they haven't even got it completely right here in the UK as yet. We are still reforming our policies, and Stacey mentioned it about, and Caroline too, about access and reasonable adjustments and multiple different things. But it has to start, we know, at a government level. They have to set the framework for systems and institutions and everybody else to act. And we all know how challenging it can be to get the focus and the attention there. Unfortunately for us, what drove our government to have this spotlight on learning disabilities and autism care was some of the atrocities that they uncovered in some of the care spaces that we had in the UK. So that kind of galvanized it. But I have to say, there is a lot of strength and power in social movement, because that's the other thing that has continued this momentum, because those who need and use the services were demanding more from us. So we had to make the changes to policy. We then had to make the investments. And I appreciate sometimes it can feel like it's an uphill battle, but I know that in some of the spaces that we're in, we can make some of those changes, and some of them are a lot smaller than we think, and perhaps maybe require a lot less investment than we realize, and I totally understand what you mean about the medical model. Similarly, you can say that extends across all care pathways, because I know I've spent time in the hospitals in Trinidad. My sister is a nurse in Swara. I went on the wards with her and worked with her for a day, and I saw what happens there. And nurses don't have the same level of autonomy, nor does our allied healthcare professionals. And it's really important for us to tap into that as a resource and help improve the access to care that we have in Trinidad. And it might be something that maybe we want to start looking at how we could start a movement in relation to that aspect as well, because it's a shame that they're not tapping into that resource.
Thanks, Adanna. Future work, Katija. There's a question. I
tried to
see you've
start
answered the question
answering it.
in the chat.
Yes,